Some of you may have seen in the media that in Parliament we will be discussing the voluntary assisted dying bill, which relates to access to that treatment in aged care facilities. And currently, aged care facilities have to provide at least access to medical professionals so that they can come into an aged care facility, which is someone's home, and provide them with information and potentially the prescription for the voluntary assisted dying drugs. So the bill that is being proposed, it seeks to allow aged care facilities run by institutions that have a moral objection, like a religious institution, to prevent a medical professional like a doctor actually coming into the facility to provide this care to an individual who has asked for it. Now, obviously, we don't want anybody to be in the level of suffering and pain or distress that might cause them to want this drug, but the reality is that people do seek out this treatment, and that was the reason that it has been legalized in New South Wales, because there were so many people who were getting these drugs online on the black market and having to take them by themselves, surreptitiously, furtively, without their friends and loved ones around them. So this was a compassionate change in New South Wales law that allowed people to access voluntary assisted dying drugs. So I think that this bill is a backward step, and it would seriously restrict the opportunity for people to choose the manner of their dying. And look, it's not something that I necessarily would choose for myself, but I don't know. The problem with this bill is that it puts the rights of a religious organisation above the rights of an individual to choose what kind of medical care they would like to access. And the current situation does not force any person to administer this drug or be around when this drug is taken by an individual. It simply means that an aged care facility has to open the doors and allow a medical professional to come in and see that person who's requested that care. So I think that that is a reasonable balance, because I understand that individuals have a moral objection to voluntary assisted dying, and I really respect that, and I would expect that those people therefore wouldn't access the voluntary assisted dying medication for themselves, and that's perfectly fine, and that's as it should be. No person should be forced to administer this medication or treatment, of course. That's not what we're saying, but the reason that I'm voting against this bill is because I think it is reasonable that an elderly person who lives in an aged care facility that happens to be run by a religious institution should still have the freedom to access that care in their home.